The latest outbreak of cholera in Sudan was reported on 12th August. This comes a few months after a new one in May infected about 11,000 people and claimed 300 lives. The United Nations now says the disease is spreading within refugee camps, especially those in Kasala, Gadaref and Jazeera states.
We have seen quite large numbers of cholera cases in Kasala. Kasala is an important area for us, hosts a large number of refugees, but also internally displaced. So far, we have 119 cholera cases in 3 refugee sites in Kasala, and 5 refugees have passed away, regretfully, of the disease.
The UN's refugee agency says tackling the outbreak has been made more difficult by the ongoing conflict between the Sudanese army and the paramilitary rapid support forces. The huge numbers of refugees from neighboring countries and the internally displaced are straining resources within the camps.
You can imagine refugee camps, displaced camps are sites where people live on top of each other. They're hugely overcrowded with the movements of Sudanese and also refugees from Khartoum, from Wad Medani, from the Darfurs to the east, to Gadaref, Kasala. All these areas have become hugely overcrowded. The water systems that were in place do not have the capacity to respond. There really needs massive investments.
On the ground, we are still facing some obstacles and some challenges, either because there is a miscommunication between the decision makers and those who are on the field, or because there are other issues. Of course, this is in addition to other challenges due to floods and the quality of the roads.
The World Health Organization says medics are now vaccinating people in the country to curb the spread of cholera. So far, 50,000 people have been vaccinated, and the current campaign aims to cover at least 97% of the target population. Wanja Mungai, CGTN.